want to go ahead and record?
Okay.
Thank you for joining us. We're going to talk today about the article, the organizational values and leadership impact staff engagement, well-being, and patient satisfaction. Next slide. Let's begin with the core findings from the article. The research showed significant relationships between organizational values, leadership styles, and outcomes like staff engagement and patient satisfaction. For example, values such as excellence and innovation were strongly linked to higher patient satisfaction. Meanwhile, leadership behaviors, especially those that are empowering and fair, were shown to foster psychological safety and trust among staff. These findings align closely with Chapter 1 in our textbook. It shows that an organization's mission, vision, and values directly shape outcomes for both staff and patients. So what we can see a clear trend is that when values and leadership are aligned and intentional, they create a culture that benefits both employees and the people they serve. Next slide. Now let's take a look at the methodology. The article did not conduct a systemic review. However, they did carry out original research using surveys and equation modeling. While they included prior studies on organizational culture and leadership, their goal was to test a specific hypothesis rather than synthesize existing literature. While they included prior studies on organizational culture and leadership, this approach contrasts with our textbook, where they stress the importance of continuous learning and integrating knowledge from existing research to guide organizational empowerment. Next slide. Let's explore the framework the article introduced. While the individual ideas like staff belonging, psychological safety, and innovation aren't new, the article integrated them into a model tailored to healthcare delivery. Their framework shows how organizational commitment to values and empowering leadership flows into positive staff experiences and ultimately improves patient satisfaction. Next slide.
Okay, so did they make any unsubstantial claims or conclusions? There were no unsubstantial claims as it was a balanced interpretation. Strong organizational values are critical to staff commitment and quality service. Important findings show that staff well-being did not correlate with patient satisfaction. Staff might be overworked or at risk of burnout despite providing excellent care. Fairness and excellence were linked to staff engagement and commitment to service excellence. Next slide. So were the methods appropriate or did they use flawed assumptions about data or approaches? There was no indication of flawed assumptions or misuse of statistical tools. Structural equation modeling, which is the method for analyzing relationships between latent, which is non-observable variables, is a powerful tool in examining relationships between culture and satisfaction. Model showed strong statistical fit. Study focused on community hospitals, which can limit the broad results as it limits generalizability. Study focused on community hospital. I'm so sorry, I messed up on that part. Established research standards or validated constructs accounted for measurement errors and transparent about study limitations. Methods were appropriate, rigorous, and carefully applied. Next slide.
Did the authors convince us of their interpretation of the results? And did we agree with their interpretation? Overall, yes, they give a very convincing statistical analysis that correlates the staff's perception of the organization's commitment to overall well-being and staff engagement. Next slide. And were the figures and tables easily understandable, or were they confusing or inappropriate for what they were trying to visualize? Here's where we ran into some difficulties. Figure 1, which was the cluster dendrogram, is blurry and difficult to read. On the other hand, the table was long but was organized and pretty simple to read. Figure 2 had some lines that were between the first order factors. They were extremely difficult to follow. Everything is the same color, so it's hard to track which line goes where. They're also very thin lines, so they overlap. And then the next figure, which was figure 3, it's much easier to follow. They're very clearly laid out, but it's not entirely clear what it's trying to convey. The figure ends on on a figure called excellence and the arrows don't flow in the other direction. So it makes this last point nonsensical. And figure 4 has the same problem. And the explanation in the text further clouds this, doesn't really clarify this in any way. Next slide. Do we agree with the implications, applications, and conclusions that they draw? Overall, yes. The conclusions that an organization is committed to its values, well-being, and psychological safety would positively correlate with patient safety. It's logical and shows significant effects across all measures such as excellence, sense of belonging, staff engagement, and trust, and that transmits down to patient satisfaction scores as well as employee performance. Next slide. And what would we have done differently if we were conducting this experiment? Overall, just redesign the figures. The study is solid otherwise. It stands on its own merits. What detracts from it is the figures because they're unclear, and if you try to understand it just from the figures, you get confused. So, next slide.
Alrighty, so connection between the readings. The readings this week connect closely by focusing on the role of organizational values and culture in shaping both staff engagement and patient outcomes. In the earlier academic medical center study, psychological safety was seen as a precursor to leadership empowerment. In contrast, this community practice study showed the opposite, that empowering leadership actually creates a psychological safety and trust. Even with these differences, both studies highlight the same core idea. When staff perceive fairness, trust, and alignment with organizational values, they are more engaged and committed to providing excellent patient care. Differences in approaches and conclusions. Although the terminology across the studies is consistent, the methodological approaches provide some differences in perspective. Both relied on survey data but used advanced tools like cluster analysis and equation modeling to reveal patterns. The conclusions were striking. Excellence and innovation consistently showed strong links to patient satisfaction. However, well-being did not show a meaningful connection. This means staff often strive to provide excellent care regardless of whether they themselves are burnt out. That disconnect raises important questions about sustainability, since professionals may continue to deliver great outcomes while struggling with their own wellness. Complementary knowledge. Taken together, these studies complement each other by covering both academic and community practice settings. The message is clear. Cultural alignment drives engagement, which in turn drives excellence and innovation. Empowering leadership and organizational commitment to values affect not only staff well-being, but also performance outcomes. Together, the findings strengthen the argument that values-driven leadership is a cornerstone of healthcare organizations. By looking at both settings, we see a more complete picture of how leadership and culture work across the healthcare spectrum. Application to education and career. These insights connect directly to both education and professional experience. In an educational setting, teaching and modeling value-based leadership can improve engagement and learning outcomes. In career experiences, fairness, recognition, and trust from leadership can directly improve motivation and job satisfaction. Personally, aligning my own values with an organization's mission has helped me stay engaged and perform at a higher level. The lesson here is that when individuals of an organization share values, both well-being and performance benefit. Authors' backgrounds. Finally, let's look at the authors. The authors are Kang, Lee, Fairchild, Cobbett, Peters, Maddie, and Howe Jr. This study was written by a multidisciplinary team from Mayo Clinic, including experts in human resources, quantitative health sciences, patient experience, quality management, and clinical services. Mayo Clinic is one of the most well-respected healthcare institutions worldwide, and the authors have a track record of publications on leadership, values, and engagement. Their diverse backgrounds threaten the study since they combine both research and real-world practice. This credibility adds weight to their conclusion and makes the findings relevant and across different healthcare settings.